Hi, I'm here with Dr. Denise Chang, who is our leader for QI in our Division of Pediatric Anesthesia. And I'm here to talk to her a little bit about QI in our division. So, Denise, tell me about your role as the head of pediatric QI.
Yeah, so I serve as the Department of Anesthesia's QI Committee Pediatric Anesthesia subspecialty leader, and also serve as the co-chair of our UCSF Children's Hospital Perioperative Process Improvement and Patient Safety Committee. So my main role is really to be the pediatric anesthesia liaison kind of between different departments and for hospital-wide QI committees. As a part of being our subspecialty leader, I also help to run our quarterly pediatric anesthesia M&Ms and coordinate our QI responses and initiatives.
Great. And how are our fellows involved in QI?
Oh, our fellows are engaged in QI work from the minute they start fellowship. So UCSF Health greatly values quality improvement and patient safety work and is committed to training our learners so that they can help really enable systemic change. So we teach the QI process to our fellows throughout our sort of built-in curricular time. And I also help serve as the faculty mentor for our fellows Reflect QI project. And Reflect stands for Residents and Fellows Leading Interprofessional Continuous Improvement Teams. And so this is a year-long incentive project for both residencies and fellowships to kind of design and implement a QI project specific to their sort of clinical microsystem. And our pediatric anesthesia fellows have been really successful in achieving their Reflect QI project goals. The fellows will generally present this QI work at our departmental grand rounds, and then we'll also present this at the UCSF Health Improvement Symposium. Our fellows also directly participate in our M&M sessions and are part of the process of relating to like how we respond to QI incidents and events.
Great. So tell me about some of these Reflect projects that we've done over the course of the years.
Yeah, so this year, one of our projects is on increasing preoperative oral Tylenol use in pre-op, which kind of goes hand in hand with decreasing intravenous Tylenol use intraoperatively. And it's sort of coming at it from the lens of multimodal analgesia, but also kind of decreasing our healthcare costs that are associated with very prevalent intravenous Tylenol use. In the past, our projects have also focused on increasing documentation of our pediatric emergence delirium scores in the recovery unit, and also a side goal would be trying to sort of decrease the incidence of pediatric emergence delirium.
Great. What other projects are going on in the QI division in our department?
Yeah, so we have multiple QI efforts going on, usually within the department, but also between different departments as well. So we have a few different handoff tools between the PICU and anesthesia teams, and also our intensive care nursery and the anesthesia team. So those are two separate projects. We also have a project on multimodal analgesia, just looking at other things other than Tylenol that we give perioperatively. And then in addition to that, we are starting a new peripheral nerve catheter efficacy study kind of on postoperative blocks for ankle surgery. And that's one of the newer research projects that is going to be in the pipeline.
Great. Thanks so much for taking the time to share that with our applicants.
Of course. Thank you for having me. Good luck.